Hello and welcome to Wellness Wednesday. I'm James Currie with the Communication Department here at MCHD. Talking to Tommie Walker. He's an epidemiologist with us here on staff. Tommie, how are you?
I'm fine. How are you?
Uh, I, I guess I could say I've been better. But anyway, first let's give our viewers and just a definition of what is epidemiology and what does an epidemiologist do.
Okay. So basically, an epidemiologist or epidemiology is the study of diseases. They are also called epidemiologists disease detectives. And what we do is study the distribution and determinants of diseases within a community at any certain point in time and find ways to prevent and control those diseases or conditions within the community.
Yeah, I would say that your profession got really busy around 2019, 2020, if you know what I'm talking about.
Oh, yeah.
Yeah, we yeah, we're talking about COVID. So yeah, we're still kind of feeling the effects of that. But epidemiology, you chart and you trend and you track diseases as they travel all around the country. It's not just you're tracking and trending things that are happening in Mobile County. It's global, it is worldwide as diseases, just as we learned from COVID, how things spread globally or and create a pandemic. So we're kind of in between, you know seasons right now, out of winter and going into spring. It's cold one day and there's pollen on the car the next day, so the weather just can't make up its mind. But you're tracking diseases and things that are going on. So I know you've got some helpful tips there for people to be able to be mindful of during different seasons, or especially right now. So you want to share those?
Well, sure. So first, I want to give out a definition of what an infectious disease is, and it's any illness or sickness that is caused by, bacteria, viruses, fungi, or parasites. And one of the some of the ways that we can prevent these infectious diseases from getting us sick is to, do things like practice good hand hygiene. We want to make sure we're washing our hands with a good lather for about 20 seconds. We want to make sure we're up to date with our vaccines. We have a increase in measles going on right now, and there's no reason that children should suffer from measles when we have a vaccine that can prevent it. So if you're hesitant about getting kids up to date with vaccines or getting your kids vaccinated, I encourage you to go out and talk to your local healthcare provider or come to MCHD and talk to someone about the pros and cons of getting vaccinated.
Mhm. Yeah, it's certainly helpful to speak to a healthcare professional. There's, as we learned from COVID, there's so many myths and things going on around about vaccines and taking them and don't take them, and it's just so much disinformation out there. It's better to get it straight from a source or a healthcare provider. Um, so, also too, one of the things you mentioned is hand washing. We should really be 4 or more years into knowing what to do about washing our hands, but we're still not doing that. And that's probably, wouldn't you say, probably the most basic thing that we can do to be preventative.
Exactly. I would say that's one of the, if not the most important thing that we can do. And there's also things that we can do, like making sure that when we clean our surfaces, our high touch areas, like our light switches and our doorknobs and our countertops, that we read our disinfectant bottle to make sure that we allow the appropriate amount of time for that disinfectant to be on the surface before we begin to wipe, to make sure that those chemicals are working to kill those germs on those surfaces.
Oh, yeah. Yeah, that's, just buying, one of those tubs with the towelettes in it with the disinfecting wipes and wiping stuff down. That's probably maybe the second most effective way, wouldn't you
Yeah.
think? I would say also too, if you're sick, you probably want to stay home. You probably don't want to be around, crowds and groups of people and be in church services and things like that. And, or if you know that you're going somewhere and family members are sick, you certainly would want to stay away from them too.
Exactly. So yeah, if you're sick, you definitely should try to avoid people to stop the spread of disease into the community. And if you're around someone who's sick or you have to take care of someone who's sick, so we want to make sure we take extra precautions when caring for them, like making sure that they're wear a mask, or if we're having to, touch them directly, we want to make sure we wear gloves when we're caring for them, and things like that could also prevent the spread of disease.
Yeah. um, and what about coughing? What's the best rule of etiquette about coughing?
The best rule of etiquette is to cough in between the crease of your arm and your elbow if you can. And I like to like carry around, hand sanitizers, just to make sure if I cough, I just clean my hands with hand sanitizer, make sure it's about 60% alcohol, and avoid touching your face and your eyes when you know you're sick or around people who are sick. It may be sneezing or coughing.
Yeah, I was recently in the pharmacy and the grocery store, and there are still standing hand sanitizer things that you can just put your hand under, and dispense. So I know that those things are still out there. So there's no reason to not be using them.
Exactly.
Well, anything else you want to add? Maybe that you know, we introduced, hey, this is what you do, and this is what you study and what you went to school for epidemiology. Is there anything you want to add? Maybe an interesting fact or something about epidemiology that people may not know?
Uh, it is the cornerstone of public health. There's not too many things in public health that we can do without epidemiology. It's basically the backbone of everything that we do in public health. So it's a pretty important field.
I couldn't agree with you more. Um, Great point. Great point to end on. Tommie, I know you're busy. You stay busy. We never see you. You're always working. So I thank you for taking the time to, you know, just talk a little bit about epidemiology here on Wellness Wednesday.
All right. Thank you.
Thanks again.
All right.